Hello there, Adventist retiree. Steve Thurmond with Forward Financial. Once again, Medicare madness is upon us. The annual election period of October 15 to December 7. This is the same window of time it is every year, and it has not changed as long as I've been in this business, which is coming up on 13 plus years now. October 15 to December 7 is the annual election period. It is the time of the year in which you can make changes to your prescription drug plan, specifically through Alight Solutions. As you recall, you must maintain one product through Alight Solutions at all times in order to remain qualified for the health reimbursement account subsidy that you get from the North American Division of Adventists each and every year on January 1st. Any changes that you make during this window of time must be made through Alight Solutions. I know all of you, like most every senior in this country, gets harassed on an ongoing basis by different brokers, agencies, commercials, radio advertisements, junk mail in your mailbox. Everybody wants your business, but it is imperative that you only make changes to your drug plan through the Alight Solutions platform. Not doing so will make you forfeit the subsidy that you get from the church and will cost you potentially thousands, if not tens of thousands of dollars over time. So you've got to maintain your drug plan through Alight, and any changes that you might make through with your drug plan must be made through Alight at all times. I am here to help you with this process, just like I have in the past. For those of you that are new, maybe new to Medicare, and this is your first annual election period, you'll want to listen to this video at length. For those of you that have been with me for years, please listen to this video at length as well. Even if this is not your first AEP, there's valuable information to be shared here, as there are changes top-down federally with all prescription drug plans in the market for 2025. This time of the year is often misnomered open enrollment. And I say misnomered because open enrollment is actually a completely different window of time, that is January 1 to March 31st. And it really has no bearing on the vast majority of you Adventist retirees that are watching this. Annual election period is specific to your drug plan when it comes to you folks. It also has bearing to people that have Medicare Advantage plans, those managed care plans that you get bombarded with via telemarketers and advertising all the time. 99.99% of you watching this do not have managed care plans. You have original Medicare, a Medicare supplement, and then a standalone Medicare Part D prescription drug plan. So again, this annual election period only pertains to that Part D prescription drug plan. This window of time, October 15 to December 7, has no bearing whatsoever on your Medicare supplemental plan. As you may recall, you can change your Medicare supplemental plan at any time of the year for any reason, as long as you are healthy and can pass underwriting guidelines. In 17 states, they have either birthday rules or Medicare supplemental anniversary rules, in which you can also change your supplemental plan to a plan of equal or lesser value around your birthday, no questions asked, even if you are unhealthy and couldn't otherwise pass underwriting. In 17 states nationwide, it's growing each and every year. You have that birthday rule or anniversary rule, or an rolling open enrollment for your supplemental plan, in which you can change your policy. Most of my clients that are watching this, a lot of you are in Tennessee, in the southern region, but at this point I have clients in 37 states coast to coast. So if you want to know if the birthday rule provision is available in your state, most of you I've already discussed this with, and you probably know whether it is or not. Tennessee is not a birthday rule state or an anniversary rule state. But I am here to help you with any of these questions that you have regardless. We're going to focus today on the annual election period and the Part D drug plan. But of course, reach out to me at any time if you have any questions about any of the products that you have with me or through Alight, or any insurance, other insurance or financial products that you want information on. As I've said many times, if I can't help you directly, I can typically point you in the right direction. So just make me your first call for anything insurance or finance related, and we'll make sure you get taken care of one way or another. So, annual election period. The lot of you, again, probably 99.9% of you that I work with, have your prescription drug plan through Alight Solutions, because you have to, and you have your Medicare Supplemental plan through me. You've worked with me in that aspect, which makes you my client, and I've also been able to help you save money by going outside of Alight for your supplemental plan. And then I help you with filing your claim with Alight and getting set up there. Any other insurance needs you may have, I've helped you through the years. That's how our relationship is established. But the drug plans you have through Alight, a lot of you have the WellCare Value Script drug plan. In Tennessee, that plan was only 40 cents this year. 50 cents this year. It was 40 cents in other states, and in a handful of states in 2024, the drug plan was actually free. Next year, I've not looked at all the states yet, but it appears that in most states next year, that WellCare Value Script plan is $0. It shouldn't cost you anything. Those of you that have a drug plan, and this should be all of you that are watching this, you will receive your annual notice of changes. This one is from WellCare right here, their annual notice of changes. You'll receive this booklet in the mail. Yours might be from Aetna. It might be from United Healthcare, AARP. It might be from Blue Cross Blue Shield. It could be from Mutual of Omaha. It could be from a handful of other drug providers. They can vary state to state. Regardless, each one of you should have received your annual notice of changes. It is just like it sounds. It is your annual notice of changes that are happening to your drug plan. If you read through your annual notice of changes booklet and you are okay with any of the changes that are coming down the pike for your specific drug plan, do absolutely nothing, and that drug plan will simply automatically renew for 2025. You do not have to proactively re-enroll into a drug plan each and every year. A lot of you email me and call me weeks or months in advance asking me this question. You only want to be proactive with your drug plan if you are negatively impacted by the changes that are going to happen to your drug plan each and every year. In my opinion, it's just a good rule of thumb to be proactive, regardless of whether you change or not. You want to at least review the changes for your drug plan for the upcoming year to make sure you're getting best value. And this is where I come in and I'm happy to help you. But a lot of you really don't need my help in this aspect, because if you're taking little to no medications, or you're taking tier 1, 2, and maybe one tier 3 generic medication, the drug plan you have is most likely going to be the best fit for you in the upcoming year as well. And if you have that WellCare Value, that cheap WellCare Value Script plan, it's going to $0 in most states next year, so it will also be the best value for you. Now, if you've logged on to your Alight account and taken a look at your drug plan options for 2025, you may have noticed that WellCare is not an offering in 2025. It doesn't matter. If you already have a WellCare plan in 2024, just because Alight doesn't offer it in 2025 does not mean you have to change your plan. You can stay with your current WellCare plan and it will automatically renew and still be deemed creditable coverage through Alight, so you still get your subsidy from the church. That's the main issue here. You may be wondering why Alight does not offer the WellCare Value Script low premium plan in 2025, and this would impact new retirees. Any of you that are watching this for the first time, you're likely already my client, so this has no bearing on you. But future retirees that are aging into Medicare for a January 1st effective date, if they're going through this scenario with their North American division through Alight, they do not have access to purchase that WellCare plan, unfortunately, and I'll tell you exactly why. WellCare and Aetna and a few other drug plans in the market have started to cut commissions that are paid for these low cost-effective drug plans. In other words, I don't get paid a commission on the WellCare Value Script drug plans anymore as of January 1, 2025. Neither does Alight Solutions. Because Alight Solutions isn't getting their piddly $2 to $3 a month in commission on that drug plan, they will no longer offer it to future retirees. This further highlights how poorly I believe you are served by Alight, but you don't have much choice in the matter. You have to maintain one product through them at all times in order to get the subsidy from the church. So we do the best we can. We jump through the hoops. We get the carrot. That's how this works. It's rather frustrating. I will still be selling and enrolling people into this low-cost, zero-premium WellCare Value Script plan, whether or not I get a commission on it. And again, this is speaking to people that are mainly for people that are not Adventist retirees. If you're an Adventist retiree, you either already have the drug plan through Alight, or you'll need to get a drug plan through Alight. And it's unfortunate that this low-cost plan won't be available to new retirees. But if you already have the plan, you're grandfathered in, so you don't have to worry about being kicked off of it. I'm sure Alight wishes they could kick you off of it and force you to a plan that does pay them a commission, but they cannot do that. So you're in good shape. If you have the cheap WellCare Value Script plan, just keep it as long as your medication hasn't changed drastically. If you're taking Tier 1, Tier 2 generics, 9 times out of 10, that WellCare Value Script plan is going to be the best fit for you, and it's zero premium per month. One of the nice provisions that has come top down from Uncle Sam, the federal government, and the Center for Medicare and Medicaid Services, is they have capped the maximum out-of-pocket cost for prescription drugs in 2025. This is very impactful for those of you that may be on expensive medications. That cap for 2025 is $2,000. Some of you are on expensive insulins, expensive blood thinners, expensive meds, and your out-of-pocket costs may likely exceed that $2,000 mark in the past. Well, it's capped next year. As long as, and this is very important, as long as the drug plan covers the medication, you have a $2,000 cap. So for those of you that are on expensive medications, you do want to take a close look at your drug plan options because it may behoove you to move to a plan that might cost a little bit more in premium, because it doesn't matter. You're going to hit that cap anyway. Even if you're on a plan that's $20 a month, it's going to cost you $240 a year in premium, but it's got a $2,000 cap on the copay on your medications. Well, that's going to benefit you if you were spending $3,000 for your medications in 2024. So for those of you, again, just to recap, that are on expensive medications, you have a $2,000 maximum out-of-pocket cap on your cost of meds, as long as the drug plan you choose covers all of your medications. If you're on a drug plan that does not cover a specific medication, well, you're going to be stuck paying full cost for that medication, and there is no cap on non-covered drugs. So it is important that we make sure that all of your meds are covered, and I am here to help you do that. Unfortunately, through Alight, the cheapest plan available, I've not looked at all states, but in Tennessee, there are only 3 carriers offered in Tennessee through Alight, and only 6 total plans available in Tennessee. Again, I've not looked at all states, so this could vary slightly state to state. In the open market, if you didn't have to go through Alight, if you weren't shackled to them by the church, in the open market, you would have access to 14 different plans from 6 different carriers. But through Alight, they only offer 6 plans through 3 different carriers. And you guessed it, those 3 carriers are the only ones that are paying a commission on that product. Again, highlighting how you're poorly served there, but I digress. So again, you want to be very careful if you're on expensive medications. You want to make this choice carefully. But for the vast majority of you out there, I put most of you, thankfully so many of you Adventist retirees are very healthy and you're on little to no medications. And I put the majority of you on that WellCare Value Script plan. It should still serve you best for 2025. And so do nothing, do absolutely nothing. That WellCare plan will automatically renew through Alight. You will still maintain creditable coverage. You will still be qualified for the subsidy from the church. So the cap is nice, though, for people that have really expensive meds. A lot of you, well, not a lot of you, a handful of you are on some expensive insulins, injectables, and that cap will be nice at $2,000. I have a few clients that hit the $5,000-$6,000 mark in medications alone, and this will be very beneficial for you folks, thankfully. We don't know how that will shake out long term. Ultimately, if the drug plan carrier has a cap on their copay, well, they're just going to keep raising rates on the premium. They're going to get their money one way or another. It's a constant cat and mouse game between big government and Big Brother. So I'm sure you are well aware of that scenario at this point in clown world. So let's see what else here. North American Division is giving you a slight increase on your health reimbursement account. If for those of you that are in the 35 plus years of service, let me just pull up the chart here really quick, and I'll pull it up for next year. Remember, there is some nuance here for those of you that have the Sharp dental, vision, and hearing coverage, and those of you that have left and opted out of the Sharp dental, vision, and hearing coverage. But I'm going to give you the full subsidy amounts here as if you did not have the Sharp dental, vision, and hearing coverage. If you're at 35 plus years of service, category A, your new subsidy will be $2,448, $2,448 for the year. You're getting a whopping extra $4 a month. Don't spend it all at the same Taco Bell. I guess it's better than nothing, but $48 a month. You should be getting an extra $48 a month, but you're not. You're getting an extra $48 a year, and so that's $4 a month for category A. Category B, your full subsidy for 2025, if you do not have Sharp, is $2,203. Full subsidy for category C, 25 to 29 years of service, is $1,958. Category D, full subsidy for 20 to 24 years of service is $1,714. And then category E, 15 to 19 years of service, you get $1,469 total. If you have opted into the Sharp dental, vision, and hearing coverage, to my knowledge, I have not gotten any numbers on the increase there. That price should still be $105 each per person per month. If you're a couple, that Sharp dental, vision, and hearing coverage is $210 a month. As I've explained to many of you before, it's good coverage, but it ought to be because it comes with a Cadillac price tag. And in my opinion, there are better priced options available in the open market if you would like to explore them. I moved my mother away from Sharp about 3 years ago, and so far I've moved many of you Adventist retirees away from Sharp for better value products in the open market. We can discuss that at any time if you'd like, so don't hesitate to reach out if you want to discuss potentially leaving Sharp for 2025 for potential savings there. The Sharp DVH coverage is really robust when it comes to hearing aids. It is overkill, in my opinion, if you're willing to get a Eargo or a Costco type value-based product that will run you about $1,500. The DVH with Sharp is overkill. You can, again, get better value from another plan elsewhere. But if you want those $8,000 jobbies from an audiologist. One nice aspect about Sharp is they'll give you a 1-year look back for a total of $4,400 toward a pair of hearing aids in 1 year. So basically every 2 years you could use $4,400 toward hearing aids if necessary. The other aspect is if you're in the middle of something serious with your dental and you have Sharp, if you're in the middle of implants or a series of crowns, you probably don't want to go flipping over the apple cart. But for a lot of you that I talk to, you're just getting 2 cleanings a year and an occasional x-ray. $210 a month as a couple is an egregious price tag for just basic and preventive care, and I can absolutely help you save some money in that regard if you would like, so just reach out to me. Good that you are getting the slight bump in the health reimbursement. I wish it was higher. I have actually sent out an email a few days ago to contacts at Adventist Risk Management North American Division, the retiree department there, expressing my discontent with how Alight is not offering you more drug plan options in the market. Again, for most of you, this shouldn't be drastically impactful because you're grandfathered in, but for new retirees, in Tennessee, the cheapest drug plan available through Alight in Tennessee is $43 a month. It's a Humana drug plan at $43 a month. And again, it's the cheapest plan that Alight offers that pays them a commission. And so they're not looking out for your best interest as retirees. They're looking out for their wallet. I always offer the drug plan as a service to my retirees, whether I get a commission on it or not. And it's my fiduciary duty to present you with the best solutions at the best value. So I will continue to sell these zero commission drug plans where they are best fit for my clients. And Alight should do that as well. But the only thing I can think of is if enough of you make noise about how you are treated by Alight and the offerings they have there, maybe they'll listen and help us all out in that regard. But for the time being, you've got to deal with them. You got to deal with Alight, and you kind of take what you can get because they're giving you the subsidy, and I don't know how to overcome that at this point. But know that I am being an advocate for you and voicing my discontent with how the options that you have, the poor options that you have through Alight at higher pricing when you can get better options outside of Alight in the open market. A lot of you have reached out to me for home and auto insurance in the past. I had a partner that I worked with just up until about last month. I had a partner, Chance Adair. He was out of Sioux Falls, Idaho. Has taken great care of many of my clients through the years. The brokerage out there that I worked with was doing a commission split with me for business I was sending them. They no longer will do that. It seems like everybody's kind of tightening up here as we move into uncharted economic waters, if you will. And so I could still send business to Chance, and I'm sure he would appreciate that. I do have a local contact here that I don't get a commission split with or anything like that, but a local contact here in Chattanooga that I've started to refer people to. So if you do want a quote on your home and auto, some of you may know this gentleman, Eddie Panagos. He's with Atlas Insurance here locally, and he takes good care of my clients here in the Chattanooga market. The rub there is that Chance worked in multiple markets, where Eddie is in Georgia and Tennessee primarily. So my options have become more limited as far as a referral source for home and auto coverage. But I'll help you wherever I can, so don't hesitate to reach out there. More and more of my clients recently have been reaching out to me in the last few years about different long-term care products. If long-term care isn't a discussion you've had with your spouse and your kids, it's something you should be having. It's something that I can help you with. There's a saying in long-term care that if you're not allocating something toward your long-term care, you're potentially allocating everything financially toward long-term care. Long-term care can be a devastating scenario. The average in the United States is that 70% of individuals will require long-term care in their lifetime. We guys in a long-term care scenario, we check out a little earlier than the ladies. Average long-term care scenario for men is about 2.5 years. For women, it's about 4 years. But in a memory care scenario, all bets are off. You're looking at 7, 8, 9 years, right about 7 to 8 years on average for a long-term care scenario when memory care is involved. And that can be absolutely financially devastating. If you want to discuss long-term care solutions and scenarios, please reach back out to me, and we can have that discussion at your leisure. I can send you information on the topic, and we can have an in-depth discussion on long-term care if that's something you would like to discuss. A lot of you, well, I think most of you, have some type of retirement solution through Empower, through the church. Looking at the numbers there, they are less than stellar on an ongoing basis. I do think there are better solutions out there for better returns that you could roll over your retirement fund into. I do not manage money. I am not securities licensed, so I cannot manage money. I have a colleague that does. But what I can offer are some competitive solutions in the annuity world. I know that word is a bit of a loaded word, annuity, with a lot of people, but this space and these type of products have evolved immensely over the past few decades, especially in the last 10 years. There's a lot of creative and competitive products. One of the downsides about the present economy and higher interest rates is that it's expensive to borrow money. But one of the upsides is you can get a competitive return. And right now, annuities are offering very competitive returns, some of the highest in history. And so if you've ever considered an annuity or it's something you want to discuss, now would be the time to do it. You may have noticed a week or so ago the Fed started slashing rates again, going back down on the interest rate, which is going to impact annuities as well. But once you get into an annuity, you're contractually locked in. And so if it's of interest to you, it's something you would want to lock in a good, favorable rate in sooner than later. The Federal Reserve only has one tool, and that's the money printer. And as they print more money out of thin air, devaluing the dollar and negatively impacting all of us, it's just the nature of the beast, because that's the only tool that they have, is raising interest rates or printing money, and they'll often pull that lever up and down, whichever way they want to jerk the economy around. It's an election year as well, so it just adds to the nonsense that we have to deal with on an ongoing basis. But I digress. I won't get political in this, at least not as political as I'd like to in this conversation. That being said, again, reach out to me. Please schedule on my calendar, stevethurmond.com. Just go to STEVETHURMOND, my full name, stevethurmond.com. Right there, you'll see my electronic business card. The top link says, click here to schedule an appointment. Click on that link, go to the calendar. Some of you have struggled to get on my calendar in the past. You have to go through the entire process, and at the very end, the last thing you should do is click the blue Schedule Event button. If you do not see a confirmation page and you do not get a confirmation email of your scheduled appointment, you most likely are not on my calendar. And if I don't see it, I'm not going to be calling you, and you're going to wonder what happened. So make sure you go through the entire process when you're scheduling on my calendar. And please use that calendar. This time of the year, the phone calls and emails just ramp up exponentially, and it's more than I can handle. So if you can just hop on the calendar, schedule the time, and we will meet at that scheduled time. I would request that you choose either a Zoom call or a phone call. I know some of you like to come in person. I'm absolutely buried this time of the year, and the in-person appointments, while I do enjoy them and appreciate them, they typically last almost twice as long when you come in person. And I have to be very mindful of my time during this time of the year to help as many people as possible. So a Zoom call or a phone call works best during this time of the year. Outside of AEP, please come into the office. I would love to see you, shake your hand, and help you out with any questions that you have. But during AEP, if it's a simple drug plan change that you need to make, then please just hop on the calendar and schedule a Zoom call or a phone call. If you would like to discuss potential supplemental plan changes, we can do that during this time as well. Really, the only reason to do that is if you feel you've gotten an egregious rate increase. Unlike the drug plans, supplemental plan premium rate increases and changes will happen based on your policy anniversary. And when I say changes, really the only thing that changes is the premium. As you age, you are statistically riskier to insure, and so the insurance carriers offset that risk by raising the rate on you as you get older. Don't hesitate to reach out. If you feel you've gotten an egregious rate increase and you are healthy, we can make a change without any kind of issue. If you feel you've gotten an egregious rate increase and you are unhealthy, if you do not live in a birthday rule state, it's likely going to be tough to make a change. But if you're not sure, just reach out to me. We can have that discussion. I'm here to help you save money and help you navigate these questions on an ongoing basis. Don't hesitate to reach out. And I'm happy to help wherever I can. A lot of you, listen closely, if you have a Thrivent policy, and you feel that supplemental plan has gone up egregiously, reach out to me. I have a creative solution in which we might be able to potentially save you money. It comes with a caveat, but it's something we can explore. Thrivent is no longer offering supplemental plan coverage. They're still an A++ rated carrier. They will still honor the contract you have with them as long as you want to keep that policy. But because they are no longer offering a supplemental plan policy, there is no new blood, if you will, coming into that risk pool. And since they don't have new money coming into the risk pool to offset risk, and as people pass away that have that policy, the only way they have to offset risk is to continue to raise rates. Nobody could have predicted this, at least I couldn't have. Maybe somebody else saw the writing on the wall. Thrivent was an A++ rated carrier and the best price when I wrote them 5, 6, 7 years ago for some of you. And that's why I put you on that policy. They've since pulled out of the market for the supplemental plans. They still offer a plethora of other products. They just no longer offer supplemental plans. Because of that reason, we can get creative here in moving you away from that plan. There's something called a trial right, where you could technically move from your overpriced supplemental plan back to a managed care plan. Now, normally I would not recommend this, and I only recommend this if you think your Thrivent policy is egregiously high in premium. For those of you that had a Plan F, some of you I've heard are paying $300 plus a month for your Plan F, and that is a bit egregious in my opinion. For those individuals, we could move you to a managed care plan for the month of January 2025, and under a trial right, you can technically vacate that managed care plan, go back to original Medicare, and since Thrivent no longer offers a supplemental plan, you have a guaranteed issue window to get a different supplemental plan at a better price. And so that's a little trick that we can pull, if you will. It's a loophole we can take advantage of to move you away from your expensive Thrivent plan if you feel it is egregiously high. So if you want to explore those avenues, I sold a lot of that Thrivent product back when it was the best price policy. It was not only the best price, but it was the only A++ rated carrier in the market. So it was the perfect product for most of you when I put you on that product. It's now been 5, 6, 7 years later. they've pulled it out of the market and prices continue to climb. So we can get creative in that area if you have a Thrivent policy. That's the only carrier that's pulled from the market that I've sold to you clients. So that's really the only scenario in which we can utilize this loophole. But that's something we can do if you don't mind that move to managed care for 1 month and then move away from managed care. And there may be a caveat there as well. I'll have to see if there's a specific timeline on that. At worst, you would be in managed care for 90 days, and then we could move you back to supplemental plan guaranteed issue per that trial right that you will have. So reach out to me if that applies to you, and we can get creative with that solution for potential savings. So I've blathered on enough. I appreciate your time. All is well with me. I know a lot of you have followed my cancer journey through the last several years, and I can't believe it's now been coming up on 3 years since I discovered I had cancer. I discovered 2 days before Christmas 2021 that I had cancer, and I can't believe that 3-year mark is rapidly approaching. So all is well, still no evidence of disease. I am controlling what I can, leaving the rest to the powers that be. So I am grateful and thankful for every day, and enjoying watching my 5 and now 7-year-old daughters grow up. They are becoming, I can't say a handful. They're a delight, but as I've said before, they're equal parts amazing and exhausting. If you've got kids, you know exactly what I'm talking about. Thank you again for your loyalty. Many of you have been with me for 7+ years now. Thank you for your business. Thank you so much for the continued referrals. Many of you have sent me countless referrals through the years. Very much appreciated. It's how I feed my family and put food on the table for my family. Referrals are the lifeblood of my business, and they're very much appreciated. If I can help anybody, friends or family, don't even hesitate to pass along my name. Even easier, just give them a link to my calendar, stevethurman.com, and they can schedule with me at their convenience whenever they want. No pressure. I won't call anybody unless they ask me to call them. You can just pass along my name, number, or the link to my calendar, and they can schedule with me at their convenience. When it comes to insurance and financial products, I can help anybody birth to death. So if you're under 65, you need an Obamacare plan, an Affordable Care Act plan, happy to help in that regard. If you need life insurance, if you need a cancer, heart attack, stroke, critical illness policy, hospital indemnity policy, I've got great income and retirement solutions that beat the pants off of your traditional 401k. You may have heard me rant against the 401k. The 401k is a terrible retirement scenario and solution, as is the 403b, for many reasons. It's great for your employer. It's great for Uncle Sam. It's terrible for you as the employee. If you've got children or grandchildren that are getting into a 401k, tell them to come and talk to me. I can give them the biggest financial leg up they could ever get moving through their working and accumulation period. And if they're young enough, they've got decades to let compound interest work its magic. So send them my way. I'm happy to talk to anybody about it. I use a tax-sheltered cash value life insurance policy as a income and retirement vehicle for anybody age 0 to about 55, and it absolutely beats the pants off of your traditional 401k, 403b, and 529 college planning solutions. So if you got kids or grandkids that applies to, have them give me a ring. I would never recommend a product that I don't use myself. This cash value life insurance tax haven vehicle is something that I use for my own retirement income solution, my wife's, and I have this scenario set up for both of my daughters since birth. My daughters, if they continue to work into their 60s, will have over 6 decades of compound interest working its magic tied to them, not to their employee. So it becomes an absolute interest and compound interest generating monster over time. And I'm happy to discuss that with anybody. So don't hesitate to send people my way if I can be of help in that regard. Some of you have reached out to me about cryptocurrency. I'm a big advocate of hard, sound money, especially as the clowns that are running things keep printing money out of thin air. If you want to discuss anything about hard assets, precious metals, cryptocurrency, I'm a big advocate of these things, and I can at least share what I know in this department and tell you what I'm doing in this regard. I cannot give financial advice because I am not securities licensed, so this is not financial advice. What I can do is educate you on your options, and I'm more than happy to do that. If you've ever talked crypto with me, you know it's something I'm very passionate about, and I'm happy to share with anybody that will listen. So that's it. I'll quit blathering for now. I hope you folks have a wonderful holiday season. Enjoy Halloween, Thanksgiving, and Christmas coming up. Halloween is my girls' favorite holiday. They love dressing up. It's almost every day is Halloween in our house because they're constantly changing into different costumes. So they're really looking forward to that. Again, just to recap here, if you have the WellCare plan and you're not taking any new or serious medications, 9 times out of 10, that plan is going to be the best fit for you. Do nothing. It'll still automatically renew through Alight, and you'll be in good shape there. If you're on serious medications that you want us to do a review on and see if there might be a better solution, or if your out-of-pocket cost is more than $2,000 this year, then since that cap is at $2,000 next year, it may behoove you to move to a more expensive plan because of that cap. Unfortunately, you're going to pay a higher monthly premium, which you still have to pay even after you hit the cap, but at least we can get you that $2,000 cap and potential savings there for sure. So yeah, don't hesitate to reach out. Any and all of the above, I am here to help. My phone number, 615-438-8359. Some of you have been calling the 800 number. I only use the 800 number for marketing purposes online. I don't want to put my personal number online anywhere, so I just use the 800 number. But when you become a client, you've got access to me personally. 615-438-8359 is my personal number. You can call or text me to that number at any time, and I'm happy to help. When you call the 800 number, it forwards to my cell, and it creates a bit of an annoying delay there between that forwarded number and my personal cell. So just call the personal number. If you have any 800 numbers stored in your phone, please delete them. I just use those for marketing purposes. One last thing. I know I've helped several of you through the years get prescriptions out of Canada, primarily blood thinners, Eliquis, Xarelto, Januvia, blood sugar medication. There's a handful of others there, one-offs that are often less expensive out of Canada. That's still working as a great solution. My own mother started taking Eliquis after an AFib diagnosis earlier this year. We've been getting her Eliquis out of Canada for the last year, and it's working really well for us, and she's saving about $600 a year by doing so. If you are not taking advantage of that, reach out to me. I can tell you exactly to where to go to potentially save money on these expensive blood thinners and blood sugar medications. Anything that's in an injectable or needs to be put on ice, you're not going to be able to get it out of Canada. But if it's in pill form, or some of the inhalers actually, some of these expensive inhalers, you can get out of Canada at a savings. A lot of you still use the GoodRx or CleverRx applications and discount cards, and those still are good solutions for specific medications. Generally speaking, you want to default to your Medicare Part D drug plan, but you can always check GoodRx or CleverRx for better pricing. It doesn't take you 2 minutes to just pull it up on your phone. Download the GoodRx app, download the CleverRx app, and compare the two. I'll often flip back and forth between the two, and just choose the one that has the best pricing there. So continue to use that if it behooves you to do so. And then the Canadian solution for these really expensive meds is still working really well for a lot of my clients. So continue to use that, or reach out to me if you need some information on that. That's it. I know I've said I'll quit blathering now multiple times, but I'm really going to stop now. Happy holidays to you folks. Thanks again so much. Reach out if I can be of help, and we'll get through this AEP once again. It's going to be a long 8 weeks for me, but my 13th year doing this now, and managed to get through it each and every time. I know I say I'm probably going to get help every year, but next year it's got to happen. It's got to happen. It's becoming too much for me to manage on my own, and I'm getting further and further behind at this point in the year, each and every year because of that. So I'm most likely going to be bringing on staff in the new year to help me just manage my current business and try to make a push to grow as well. So we'll see how that works out. Much love to you all. Take care. Thanks so much. Bye-bye.